Yes. So good afternoon, everyone. And I'm Dr. Pramila Kalra, Professor and Head of Endocrinology at Ramaya Medical College and Memorial Hospital. Today is World Diabetes Day. That is November 14th. We know today is also Children's Day, but we also observe this day as World Diabetes Day, which is the birth anniversary of Sir Frederick Banting, who discovered insulin along with Best of Canada. So, today we have organized this panel discussion to discuss the basics about diabetes care, what all we need to do, and what we are offering at our center. So, we have all the faculty from our department who are participating in the discussion today. You're free to put your questions online, and we'll be happy to take those questions over the next 1 hour. And now I hand it over to Dr. Bharti.
Good afternoon, ma'am. Good afternoon, everyone. Ma'am, the first question is, what is Comprehensive Diabetes Clinic? And what is the vision and mission statement for MSR Comprehensive Diabetes Care Clinic?
So, when we talk about comprehensive diabetes care, what is comprehensive? Comprehensive means we do the full diabetes care under one roof. So, what it encompasses? It means that diabetes care is not just glucose control or sugar control. It actually means that we have to care or give a full holistic care to our patient, which includes targeting the patient's exercise, telling the patient about diet, and also doing the monitoring for all the complications. So we know that diabetes patients can have propensity to get multiple complications, including the heart complications like cardiovascular. They can get problems with their eyes, kidneys, nerves. They can have some gastrointestinal issues also. They can have problems with their feet. So, this is what is the concept of a comprehensive diabetes care, which we are providing at our center, where under one roof, the patient is getting access to all this. And we can see that the patient's glycemic control is achieved. The patient is monitored for all the complications. They get access to all the specialists. The full team sees them. And they also get their foot clinic done. The foot care is told to them. And they are also taught about diet and exercise. So that is the basic concept of comprehensive diabetes care. This also includes doing the biochemical investigations which are done in the lab, including HbA1c, serum creatinine, SGPT, SGOT, patient's liver function test, then also to see for any protein leakage from the urine, also to check that if the patient's vascular supply has any issues, if there are problems with the arteries by doing an ankle brachial index, also to check the feet of the patient, and not to forget to check the eyes as well and the heart also. So this is what is the basic concept of comprehensive diabetes care, which we are offering at Ramaya Memorial Hospital.
Thank you, ma'am.
So,
now,
uh,
ma'am, now
Dr.
the
Bharti,
second
you
question
can,
is to
Dr.
Dr.
Chitra
Chitra,
has
ma'am.
joined. Yeah, she has
Yes,
joined. Yeah. Dr. Bharti, you can go ahead with the question, please.
Ma'am, the next question is for Dr. Chitra, ma'am. Ma'am, can we know what is patient-centered collaborative care and why is it important?
Thank you for this important question, Dr. Nikita. So all along, traditionally, we've been practicing medicine where we believe that the doctor knows more than what the patient might know about their condition. And we for patients from a paternalistic attitude. So you have to do walking, you have to take all your medications, you have to get 8 hours of sleep. But now we have moved slowly towards understanding that diabetes is a part of a person's life. The person is still continuing to go to a job, take care of his children, take care of the house, continue should be decided by both the patient and the doctor being on a same platform, equal platform, where one person is not above the other, where we are sitting with each other and saying, I'm considering this medication might suit you well. Do you think it will suit you well? So when you open up this conversation, you take the challenges that your patient might anticipate while they start treatment, you factor them in and make choices which might be better suited for your patient. This is called collaborative shared decision making, and there is solid evidence to suggest that this approach of management of diabetes definitely improves outcomes than a paternalistic traditional pattern of treatment. Over to you, Dr. Nikita.
Thank you, ma'am. Ma'am, our next question is for Dr. Ganvi, ma'am. Ma'am, may we know what is meant by being evaluated at the Comprehensive Diabetes Care Center, and also is it necessary to undergo these evaluations?
Nikita. So, at the Comprehensive Diabetes Care Center, complete medical the initial visit where the diagnosis is confirmed and the diabetes is classified accordingly. Also, the diabetes complications and the comorbidities are evaluated at that time. So also the previous treatment, if the patient is on, is reviewed again, and also the medication taking behavior as well as the medication intolerance is reviewed. Also, the other behavioral factors like the eating pattern, the physical activity history, the weight loss history, as well as the sleep behavior is assessed. The patient is then actively engaged in formulation of a care for the diabetes management. So also the use of technology is assessed, like the glucometers, the techniques of insulin administration, about the use of the continuous glucose monitoring system, as well as the insulin pumps as well. Also the hypoglycemia risk assessment is also done in order to identify the social support, the care plan, also including the financial as well. And then a complete physical evaluation is done where the anthropometric measures are recorded, the blood pressure and the postural hypotension, if at all, if there is any, is recorded. As well as fundoscopic evaluation is done in order to rule out retinopathy. The skin evaluation is done to look for dystrophy, that is lipodystrophy, that is which could be a sign of improper insulin injection technique. Also, the comprehensive foot evaluation is done, as Madam told previously, where the skin integrity is assessed, and we look for calluses, foot deformity, ulcers, as well as the toenails are also assessed. Also, the neuropathic examination as well as the vascularity of the foot is also assessed here. Also, the patients here are then screened for depression, anxiety, as well as behavioral problems. Then the lab investigations are done. So we do the HbA1c once in 3 months, and annually a few investigations like the lipid profile, liver function test to screen for non-alcoholic fatty liver disease. Then we do the creatinine, the urine albumin creatinine ratio to assess for nephropathy. Then we have the TSH, which is done in type 1 diabetic patients on a yearly basis. Then we do B12 levels in patients, those patients on metformin who complain of neuropathic symptoms, and also the electrolytes are assessed in those patients who are on ACE inhibitors, ARBs, or even diuretics. Also, these patients are counseled regarding the immunization against hepatitis B, influenza, pneumococcal, Tdap, that is tetanus, diphtheria, and pertussis, and also herpes zoster. Also, the other comorbidities like the osteoporosis, hypogonadism, obstructive sleep apnea, and periodontal disease is assessed here. Coming to the next question, yes, it is necessary to undergo these evaluations because, as we know, diabetes can involve each and every organ. It is a multifaceted disease which can lead to both micro and macrovascular complications. Hence, promptly preventing these complications, promptly identifying them and treating them at an early stage can prevent the long-term misery. Thank you, Dr. Nikita.
Good afternoon, sir. This question is to Dr. Manjunath, sir. What is multidisciplinary clinical delivery and what are the benefits?
Yeah, good afternoon, everyone. I'm Dr. Manjunath. Yeah, so when it comes to multidisciplinary care, been discussed elaborately. So, multidisciplinary team approach is an approach where there is involvement of several professionals from different disciplines. So it is not only the clinicians who are actively involved here. We have to also include the dietitians, nurses, physiotherapists, respectively. So these are the other group of people who are included in a comprehensive diabetes care. So when it comes to the delivering aspect, so what happens is when we see a patient, we'll counsel about patient with the diet, exercises, and medications and all those things. So when it comes to delivering it, it's about prescribing the exact diet what which has to be tailor made for each and individual patient, but also about the lifestyle changes, exercise, delivering these services to them exactly to how exactly they have to carry it over, like how many minutes of exercise, what type of exercises. These are all what we get as a comprehensive package from the other professionals who are involved. And when it comes to the clinician aspect, so in a single roof, all the issues pertaining to the patients will be addressed, be it like the cardiology, nephrology point of view, or vascular point of view, or neurology. Also, all the uh, specialties will be involved in catering to the patient. So when it comes to the benefits, what the patient can have, so there are two things like the benefit with respect to the healthcare professionals and with respect to the patient also. So what happens is with respect to the patient, definitely because of that multidisciplinary approach, they'll be having a better coordination with respect to the patient and with the clinicians and the services also. There'll be better patient outcomes. It will be smoother for the patient to carry on the treatment, and there will be reduced duplication of the investigations or services what the patient might require. And when it respect to the healthcare services, without doubt, there will be better patient outcomes, and it helps to diagnose a few things at the earliest point of time and helps to prevent few complications. And it helps in enhanced patient satisfaction and outcomes also. So these are the multiple benefits what the patient can have with the help of multidisciplinary team action.
Thank you, sir.
Thank you,
Our
sir.
next question is for you, sir. Is food care included in comprehensive diabetes care?
Yeah, as already been discussed, so food care is one of the most important thing what has to be thought about when the patient with diabetes comes, because the diabetic foot amputations are increasing. So if suppose the patient, at risk has been identified at the earliest point of time, which is one of the most important element of our comprehensive diabetes approach. So the amputation can be prevented. Definitely, food care is a component of multidisciplinary modality. So important things what has to be kept in mind when we are advising the food care is we have to ask the patient to inspect the food regularly, either with the help of a mirror or for any patient with the help of any attender or anybody. So the foot has to be clearly inspected in between the toes, soles, and you have to look for any corns or cracks or ulcer, these corns or cracks, because you have to prevent the formation of ulcers, which leads to complications. And we have to advise the patient to moisturize the foot daily, but not in between the toes. And we have to ask the patient not to touch we have to ask the patient to clean the foot with lukewarm water with mild soap, not hot water, definitely. So whenever they're examining whether the water is hot, either they have to do it with the help of elbow or with the fingers. And we have to advise the patient to use seamless socks of woolen or cotton, but not nylon. And we have to advise them to cut the nails across, and at the edges, we have to be very careful. It has to be filed, and we have to ask the patient to select the footwear appropriately and very carefully, which is made of microcellular rubber or other silicone or other materials. And we have to ask the patient to have a better insole which can equally distribute the pressure, and the outsole should be hard enough so that any nails which come in the way are not patient not get injured. And every time before wearing the footwear, the patient has to clearly inspect the footwear for any thorns or any other materials which can be inside. And he should have it, the shoe should have a wide toe box, and the space should be of flexion and extension. So, and they have to select the footwear only in the night, and it has to be one size more. So these are the few important aspects regarding the diabetic foot care and footwear, what the patient will be educated and has to be like told.
Thank you, sir. The next question is for Dr. Ganvi, ma'am. Is there an education program at comprehensive diabetic care, and should patients be educated regarding the same?
Dr. Bharti, for the question. Yes, here in the comprehensive diabetes care, the patients are counseled regarding the following aspect. One is they're given the basic information about the diabetes and also the management. They're also taught how to use the diabetic devices such as the glucometers, the pens, the pumps, as well as the CGM devices. They're also taught the ways to adapt a healthy lifestyle, like the eating pattern, the meal planning, the weight loss strategies, and also the skills how they can manage diabetes in a better way. So they're also taught how to monitor the blood glucose, and they're also taught how to interpret these reports and how to respond to them effectively. In the education, they also they're made to understand how the medications work, basically the mechanism of action, the side effect profile, the toxicity, as well as dosage. They're also taught the ways of handling the complications like the hypoglycemia, the diabetic ketoacidosis as well in the initial stages before they come to the hospital. They're also taught the ways of handling the stressful situations as well. So it is important to have such an education to manage the diabetes in a better way, so that the patients are made to are taught regarding their condition and how they can be counseled, and also they can set and meet certain behavior as well as treatment goals in order to achieve optimal health outcomes. Thank you, Dr.
Thank you, ma'am. My next question is for Dr. Chitra, ma'am. Ma'am, what is the role of digital therapeutics in comprehensive diabetic care?
Right. Thank you, Dr. Nagita. So I think COVID has taught all of us to relook at life differently. And I think we all rose to the occasion quite well. We took on to teleconsultations and video consultations. And I think we all agree that it has definitely made continued access to care easier. So digital therapeutics is nothing but using technology to deliver healthcare better and to improve patient outcomes. So we at the Comprehensive Diabetes Clinic in the Department of Endocrinology do offer teleconsultation services. As part of the clinic, we also have a digital platform which is integrated with our electronics health record at home. So there is going to be an app which the patient can download on their phone, and an app which is there on the doctor's phone as well. So if you want to upload your sugar readings and get almost real-time messages to let you know how to adjust your insulin dose, or if you want to log in your exercise, if you want to log in your blood sugar values and send photographs of your phone, we will soon have a team of nutritionists who will be able to look at it and suggest treatment changes that will make sure that blood sugar levels will improve. Also, we are looking at integrating the we have, which can check your sugars 24 hours, and we can take a look at that to find out what food triggers which push up your sugar, so that we extremely personalized and individualized matter. And digital therapeutics is also where we use digital technology to advance diabetes care. An insulin pump is an instrument which can deliver insulin take data from the sensor to your pump, which then can decide the dose of insulin that needs to be pushed in every few minutes into. And managing diabetes is getting a whole lot easier with the use of technology. Reach out to your doctor to find out my
Thank you, ma'am. The next question is for Dr. Pramila, ma'am. Is comprehensive diabetic care only for adults with type 2 diabetes?
Yeah, Dr. Bharti, thanks for the question. So, yes, it is not only for type 2 diabetes, it is for all other types of diabetes and for children as well. We know that there are two major types of diabetes. One is type 2 diabetes, where predominantly there is a problem with the action of insulin initially, and over a period of time, they may have insulin deficiency as well. But the other type of diabetes, which we see mostly in children, we can also see in adults, is type 1 diabetes, where there is total deficiency of insulin. So these are the two basic types of diabetes which we are catering to, but we also cater to all the other types of diabetes. There's very other important entity which is called as gestational diabetes, where women get diabetes during their pregnancy. And this comprehensive diabetes clinic also has a package for pregnant women with diabetes, because we need to follow them throughout their pregnancy and even after they deliver, because post delivery their chances of getting type 2 diabetes or pre-diabetes is very high. So that's why that is another type of diabetes. And there are many other types of diabetes like pancreatic diabetes, there is MODI. So all the types of diabetes are covered in the comprehensive diabetes clinic. Basically, all diabetes patients need follow up with regards to their HbA1c, with regards to their kidney functions, eye checkup, cardiovascular checkup, nerve checkup, and food checkup, which is done for all these patients. For gestational diabetes, there may be a little different set of the care required, which is tailor made for them. For patients who have type 1, will need a little bit different set of care, which is again tailor made for them. We have diabetes educators who take care of type 1 diabetes kids, who can call the educators and tell their readings, as Dr. Chitra was alluding to, that we can have online consults, we can have consults through phone, through WhatsApp, where the patients send their readings, and it can be much of a real-time thing, and the dose of insulin can be adjusted. So the comprehensive diabetes clinic, which is run by our hospital, is basically catering to all types of diabetes, and the programs are tailor-made as per the type of diabetes.
Thank you, ma'am. We have one more question for you, ma'am. Ma'am, does comprehensive diabetes care deal with diabetic distress?
Yeah, Dr. Nikita, this is a very, very important aspect of diabetes care, because one, we talk about care, and the second thing we call about is the diabetes distress. Uh, Doctor, hello, am I audible?
Yes, ma'am.
Dr. Nikita, sorry, I missed you. Can you please repeat the question?
Yes, ma'am. Ma'am, does comprehensive diabetes care deal with diabetic distress?
Yes, definitely. Diabetes distress is a very, very important topic in the management of diabetes. We also call it as diabetes specific distress or diabetes related distress. Now, basically, this is a response of the people who are living with diabetes. It's a sort of an emotional response, because they have the burden of the disease. They are worried about the complications. They are worried about the follow up, what will happen to their future. It is not exactly the same as depression, though it is known that people who already have a borderline depression may be more prone to get diabetes distress. But actually also it is known that it can happen more in younger population as compared to older people, because they are more worried about getting diabetes and the complications in future and loss of the productive years of their lives. Also, it is seen that diabetes distress happens more commonly in women as compared to men. So it is very important that diabetes distress should be catered to. So the answer is that in our comprehensive diabetes clinic, this is a major thing which we are catering to. We do take care of the diabetes distress. The how to take care of the distress, we have psychologist consultations who help them, but before that we are there to help the patient, to counsel the patient. We have our diabetes educators who take care and talk to the patient. So all the problems or all the apprehensions which they have about their diabetes control is taken care of, and they are told about how to monitor their glucose values, how well they can prevent their complications, and they can lead a very helpful and a good productive life. So diabetes distress is taken care of, because that's a part of the comprehensive diabetes management, and it is one of the major parts. one of the components.
Ma'am, I think your voice is muted, ma'am.
Can you hear now? So yeah, diabetes distress is something, shall I just tell once again? So diabetes distress is taken care of in our comprehensive diabetes clinic. Diabetes distress is something which is a very, very important aspect which we see in patients with diabetes, because they have this emotional response to the fear of getting the complications, their glucose values not getting controlled, and they feel burdened with the disease, and they think that they have to live with this burden, or they may get a lot of complications. This is what the distress is, and it is seen more commonly in young women. It is seen more commonly in the young people as well, even the young men. Less seen in adults who are older, seen in younger adults, because they are more worried that they may get more complications. They may have to live with this disease for longer, and they are worried about the complications. So in our comprehensive diabetes clinic, this is aptly taken care of. We have psychologists to help them. We have our faculty who talk to these patients and allay all their anxiety or whatever the problems or apprehensions they have about their diabetes management. We also have our educators who give them ample time and explain them each and everything, starting from their treatment aspect to the complications, and how they should monitor their glucose values and what all they can do to prevent the complications. So this way we are taking care of the diabetes distress. We also have to understand that diabetes distress is not the same as depression. So it's actually not a depression. It can be taken care of by doing a proper counseling, by explaining to the patient how the disease can be best managed. And it can happen in patients who have depression more often. But still, if we counsel the patient properly, if we talk to the patient and we explain them what all needs to be done for controlling their glucose values, as well as taking care of the complications, the diabetes distress can be aptly managed, and which we are doing in our comprehensive diabetes clinic, which we are running at Ramaya Memorial Hospital at the beginning, as of now.
Thank you, ma'am. Next question is for Dr. Chitra, ma'am. What are the other specialty care comprehensive diabetic care offers?
Right. Thank you, Dr. Bharti, for that question. So, amongst the comprehensive diabetes care allied teams that we have, we're beginning to understand that we have to work together to make sure that we are effecting better outcomes. And one important team as doc psychologists and our diabetes educators. Much of the distress to diabetes does in fact push up our blood sugar levels, and very important. We also have a robust physiotherapy team. Uh, Usually when we recommend exercise for individuals with diabetes, we give a generic recommendation which says go for a walk. But our physiotherapists here are able to do a comprehensive evaluation to assess your baseline health and then make specifications for your exercise prescription, which you can work on and come back to meet them at an interval to assess your progress and then get a and balance and flexibility by continuously challenging our muscles, that is referred to as progressive overload. So we have a robust team of physiotherapists. We also have our nephrology team, our cardiology team, our ophthalmology team, our vascular surgery team, all of whom help us take care of all the various aspects of consequences of diabetes. Let's say, for example, diabetic kidney disease or diabetic retinopathy, or even heart disease secondary to long-standing diabetes. So you do not have to run around to find all of these specialists. We can get all of their care under one roof. Over to you, Dr. Bharti.
Thank you, ma'am. My next question is for Dr. Ganve, ma'am. Ma'am, is immunization covered under comprehensive diabetes clinic?
Yes, immunization, the routine immunization is advised for all the patients with diabetes in our center. So the importance of the routine vaccination vaccination has been elevated, especially following the COVID-19 pandemic. So preventing avoidable infections not only directly prevents morbidity, but also decreases the hospitalizations. So the routinely prescribed immunizations are the hepatitis B, which is recommended for all patients less than 60 years, about 2 or 3 doses, and more than 60 years, it is as per the healthcare professional discretion. Also, human papilloma virus is being advised for all patients less than 26 years. 3 doses over 6 months is recommended. And between 27 to 45 years, again, at the discretion of the healthcare provider, it is being advocated. So influenza is also recommended for all the diabetic patients annually. There are 2 variants of the pneumococcal vaccine. One is the 23-valent pneumococcal polysaccharide vaccine, and then we have the single valent, that is the 13 PCV 13 vaccine. So the 23 valent vaccine is being advocated for all patients with diabetes between 19 to 64 years, and more than or equal to 65 years, it is being advocated as a second dose, or at least if it is beyond 5 years from the last dose. Also, Tdap, that is the tetanus, diphtheria, and pertussis, is recommended for all the adults, and including during pregnancy, and extra doses recommended. So even zoster is being recommended for all diabetic patients more than 50 years, irrespective of whether they have received the previous dose. So this is about immunization, which is being routinely advocated in our department.
Thank you, ma'am. Next question is for Dr. Manjunath, sir. This is one of the most trending topics. Is remission of diabetes mellitus possible through comprehensive diabetic care?
Yeah, thank you, Bharti. See, when it comes to remission, most important thing what we have to know is whether it is possible for all types of diabetes. Definitely, it is not possible for all types of diabetes. This term remission can be possible in only type 2 diabetic patients, not in type 1 diabetes or not other like gestational diabetes or pancreatic diabetes or any other thing. It is possible, or it can be used in connection with type 2 diabetic patients. And when it comes to remission, so what exactly is remission is what we need to know. So remission is a terminology what we use when the blood glucose levels are less than 5.7, HbA1c levels are less than 5.7, and the blood glucose levels less than 100. There is something called as partial remission also, but complete remission is described like this, with HbA1c less than 5.7 and blood glucose levels less than 100, without taking any medication or without any ongoing surgical procedure. So how do we achieve this remission is basically this remission can be achieved either by your proper lifestyle modification with help of diet and exercises, or it can be possible with surgical interventions like bariatric surgery. So we are more concentrating about the lifestyle intervention. So definitely with the help of proper lifestyle intervention, remission is possible in patients with type 2 diabetes, and we do cater this aim of remission. So whenever we are treating any diabetic patient, our goal is towards remission in type 2 diabetes with the help of proper lifestyle modifications and with proper medication. And the most important thing is we should know at what level of the disease is remitted. So suppose the patient has so many multiple comorbidities, that is not when we think about reversal or remission. So we can think about remission in the earlier disease process, or who is like overtly obese with A1C levels slightly high, or with no other complications and sugars are high with multiple medications. So these are the patients whom we can target in bringing down their blood glucose levels to the remission level. Or any patients who enters our clinic, we aim at bringing the A1C levels to the remission level.
Thank you, sir.
Thank you, Bharti.
So, Bharti, we have any questions from the
Ma'am,
audience?
there are no, ma'am, there are no
Okay.
questions from the audience, ma'am.
Okay. So today we had a nice discussion on the comprehensive diabetes care. We know that diabetes care is something which is not done only by the endocrinologist, but it is done by the endocrinologist and their team. And the team includes the diabetes educator, dietitian, physiotherapist, as well as the other super specialists like nephrologist, cardiologist, vascular surgeon, ophthalmologist. They all are the part of the team, including the psychologist, because we discussed that diabetes distress is a major problem in our country and all over the world. And we need to counsel our diabetes patients adequately so that they can take better care of their diabetes and comply with the medicines also better. We also told you that we have this comprehensive diabetes clinic where we are offering all these things under one roof. We have patients who come to us with the diagnosis of diabetes and they are given the holistic care starting from their complication management to the management of their glycemic levels to their foot care and taking care of their diabetes distress as well. And we also have a team of diabetes educators with us and nurses who can take care of these patients through the phone or online for their glucose levels after discussion with us. So that also is also available for the patients. Also, this comprehensive diabetes care is catering to all types of diabetes, including the type 2 diabetes, which is the commonest, then type 1, also the children, gestational diabetes, and other types of diabetes also. Patients can walk into the OPD, they'll get the full care, and that can be done in a single day. So we have this diabetes comprehensive care, which is available at our center at Ramaiah Memorial Hospital. Also with that, we also see that the patient's further care is taken care of, meaning to say that some patients who develop different complications, they are referred to the department because they may need further care in the different super specialty departments. So with that, I think if we don't have any further questions, I thank all our faculty to be part of this discussion. And if any questions are there, we'll be happy to answer. But at the moment, I don't see any questions in the chat box. So we will we'll close this session at the moment. So good evening, everyone.
Thank you, ma'am.